school districts in New Hampshire are exploring new approaches to address the opioid crisis, and they're getting support from the State Department of Education, which has received grants to institute new ways to try and reach students before they try drugs and support those who have already started or who have family members struggling with addiction. Here to speak with us are several people involved with implementing these programs. We have Mary Steady from the Department of Education and the Office of Student Wellness. We have Nate Green from the Winnisquam School District, who is in charge of the Director of System of Care Office, and then also from the Department of Education, the Office of Student Wellness, we have Kelly Unteep. Thanks for joining us today. We appreciate it. Nate, let's start with you. That perspective on the ground, these young people are dealing with both, some of them, actual addiction, and then others who may not be addicted, but they have family members who are.
Sure. So one of the things that we wanted to, when we started to receive some of this grant money in our school district, is not just look at addiction itself, but what are the root causes. So we went through probably about a 3-month process where we pulled in community members, we pulled in school personnel, parents and students, and we really tried to look at what are the risk factors. What are the things that are leading students to try drugs in the first place, and what are the situations and environments that keeps them continuing to come back to drugs, which can lead to a problem. So we looked at things like trauma in the home. We have a lot of students right now who are going home to empty houses after school. Maybe they have single parents, they have parents who are working. We have students who are victims of abuse, excuse me, or who witness violence or aggression or abuse. So these are all things that we wanted to try to start to tackle from a school perspective in an effort to try to change the environment before students really decided to turn to drugs in the first place.
Mm-hmm. And Mary, where does the grant funding from the State Department of Education come in here to assist?
So we receive funding from Substance Abuse Mental Health Service Administration, federal DHHS. We help the school districts implement this framework. So about 4 years ago, we recognized some of the reasonings for kids using or misusing substance, and we decided that we needed to dig further to develop a framework. So we worked with about 50 partners across the state to develop this framework, and we select schools based on needs, their readiness and willingness to implement a framework. So as Nate had spoken about earlier, schools go through this needs assessment to really look at what's happening in their communities and taking this whole child approach and a whole system approach and framework within schools. So we know kids are in schools at least 7, sometimes 8, 9 hours a day. So we wanted a system that met kids where they are at. So we're taking and putting mental health services and substance misuse services within the school. So we help these school districts pilot this project.
And Kelly, you can speak to this, the idea of the regionalizing and coordinating and make sure everyone's sitting at the table together. How important is that to make sure everyone's on the same page?
It's, I think, the most important piece of our work. Central to the framework is the idea that schools can't do this alone, and that we have to pull in all aspects of a community, whether it's various service providers, elected officials, parents, the youth themselves, and get everybody around the table and say, what is it about our community that is so that we can leverage to really make a difference for kids who may be struggling.
Mm-hmm. And it seems important to know that what you've been saying is there doesn't seem to be a one-size-fits-all. You're saying you have to meet that person, that child, that student, maybe even someone on the way to being an adult, where they are. It has to be a matrix of services, I guess. Is that correct, Nate?
Yeah, I would agree with that. And one of the things that we're really trying to work hard at is breaking down those silos. You know, we have so many youth and family serving organizations in our state and in our communities, but oftentimes they're doing their work in isolation. One of the things the grant has allowed us to do within the school district is to bring a lot of those partners together and to have meetings within our community to say, you know, if we're going to bring services into the school district, if we're going to bring in, say, a nonprofit organization that's already doing work in the community, what would that look like? How can we start to change policy and change infrastructure to get everybody who's working for youth and families on the same page and to the same table so that we can really streamline the process, make it more efficient for kids.
And Mary, so many people want to know kind of when we can be optimistic about this. This will be a lifelong struggle, I think, for a lot of people, but is there hope here?
I feel like there's a lot of hope. If we look at our youth behavior risk survey over time, that is, our drug use has starting to trend down. Marijuana use hasn't amongst youth. However, kids and family members and school personnel are seeing changes within the school, higher access to services for youth and families. I want to stress that some of the services aren't just for the children and youth. They're actually home visiting being done within this project to reach families where they're at. And also school personnel and administrators are gaining time back in the classroom to be able to focus on academics, so there's a lot of hope.
All right. Mary Steady, Nate Green, and Kelly Antide, we thank you for your expertise and the work that you do.
Thank you.
All right.